Well, hello, Stephen. We are back here together for a small interview to talk about the Havening Techniques. One of the things that's important is the extensive scientific research. Can you tell more about that?
Yeah, well, first of all, Havening was developed by my good friends and colleagues, Dr. Ronald and Stephen Rudin. Dr. Rudin himself is a Harvard University academic. He's got the largest private medical practice in New York City. He's also a neuroscientific researcher, and he's wrote a couple of books around neuroscience in context of trauma and anxiety-based issues, such as When the Past is Always Present, The Craving Brain. And he spent over 10 years research, really developing Havening to get it to where we have it today. In terms of independent studies and research, King's College London, there was a study done about 4 years ago with Professor Neil Greenberg. He's the head psychiatrist there. They took in a group of people with severe trauma, anxiety, and depression. I'm talking about people who have been in horrific car accidents, war veterans, people have been, even raped. So really severe trauma work they did. They found that the impact of one single Havening session produced complete turnaround for over 70% of the participants. So one session, massive results, and the other 30% also had significant changes. There was also a study done very recently, actually this year at the beginning of September, Cardiff and Reading University, and that's really about, once again, the effectiveness of Havening on emotional and physiological consequences of trauma, and once again how it helps free people from the symptoms that are created by anxiety-based issues and traumatic events.
Wow, that is really amazing, and it's also good to know for people who are very interested in the training that they can work with evidence-based techniques, basically.
Yeah. In the training, and I'm just going to reveal something to you now, just to give people a little preview of what's in the training. Obviously, we're going to cover the neuroscience behind Havening in the training, the latest science on how trauma becomes encoded in the brain and the body. And the big discovery, just to reveal this to people about trauma, what Dr. Rudin discovered, the big breakthrough, if you like, is that when someone has a traumatic event or a distressing experience, something called AMPA receptors get encoded in the part of the brain called the amygdala on neurons. And everything that that person's experiencing in that event, all the distress, the emotional, the physical symptoms, heart beating, sweating, fear, anxiety, anger, whatever's happening is getting encoded in those receptors. So if something reminds you of that past event again as you go through your life, it brings back the anxiety. Now, with the Havening, what the Havening does, it actually removes those receptors off the neurons in the amygdala and frees the person from the trauma, the emotional, and the physical distress. And we can do that within minutes. So in the Havening training, we're going to teach you how to pinpoint and identify those memories and events where those AMPA receptors are, then apply the Havening techniques on them to achieve the remarkable and extraordinary results that it produces, and how that works within minutes. So we can get these results within minutes. It doesn't take weeks or months of therapy, and we're going to be doing many live demonstrations showcasing those types of results over the 2 days.
Wow, that is great. I'm really looking forward to the next training. Thank you, Stephen.
Thank you, Ina.
Okay, bye.
Bye now. Bye-bye.